Adenomyosis is a medical condition where the inner lining cells of the uterus, or the endometrial cells, start growing within the walls of the uterus. This causes the uterus to become bulky and much heavier. A heavy uterus means more painful and heavier periods, as well as pressure effects on surrounding organs. This often means lower back pain. In fact, I've seen women who have had their lower back pain extensively investigated with CT or even MRI scans and treated with physiotherapy or chiropractic, only to discover that it was adenomyosis all along. Like many women's health conditions, unfortunately, we're not 100% sure as to what actually causes it. But it's likely to be multifactorial, with genetic, environmental, and maybe some developmental links. We often see it in women between 30 and 50 years of age, and whose hormonal makeup is estrogen rather than progesterone dominant. High-quality ultrasound and MRI are pretty good at picking it up, but definitive diagnosis really requires tissue. We seem to be seeing more adeno these days, and it might be because we have better imaging tech and maybe we're better at diagnosing it. But I wonder whether it might be because progesterone is actually protective. In my grandmother's generation, women had more children, to the point where they'd spend decades either pregnant or breastfeeding, thus conferring a high progesterone environment. To that end, we have tried to treat or even stall disease progression with progesterone, like the Mirena, or even turn off the ovaries altogether using GnRH agonists. Sometimes, uterine artery embolization can also be helpful, but ultimately, unfortunately, the only real cure that we have is to remove the uterus. Of course, we can only really do that once you're done using it, having a family. But the good news is, we can probably do it via keyhole surgery, and it is incredibly effective in restoring quality of life. In fact, in severe cases, the biggest complaint I get post-hysterectomy is, "Geez, Vinny, I wish I'd done this years earlier."